I'm Dr. David Beaulieu with more news you can use. And today, I want to talk to you about my doctor. My GP. An outstanding clinical practitioner, person who I think is the best GP in Kansas City. I'm not going to mention her name here because if I did, powers that be probably wouldn't look favorably on her. I want to talk to you also about a group called the Healthy Medicine Academy, and they're putting on their fourth meeting, their fourth annual Integrative Cancer Medicine Symposium. That's the fourth annual Integrative Cancer Medicine Symposium. This is about doctors, medical doctors, who are in the process of integrating alternative natural therapies with some of standard and customary cancer care. This is a beginning. This is a start. This is the beginning of getting away from cut, burn, and poison, which is the standard of care in medicine with cancer today. Healthy Medicine Academy is dedicated, and I'm reading this to you, is dedicated to the pursuit of truth and the restoration of trust in medicine. The pursuit of truth and the restoration of trust in medicine. Now, this isn't a huge group of medical doctors. We've got hundreds of thousands of medical doctors in the United States. And there may be 500 doctors, 700 doctors show up in November down in Phoenix for this convention. And that's a tiny group, but it's a beginning. And these are doctors who recognize that trust in medical profession's been lost. And it's been lost because it stopped working. If you've got a doctor who puts you on antibiotics and tells you to take a probiotic to protect you against the side effect of antibiotics, you hold on to that doctor. They're reading the research literature. If you've got a family doctor who's telling you, you better at least, at very minimum, take a multivitamin every day, you hang on to that doctor. He's beginning to pay attention to what the scientific research literature is telling him. If you've got a doctor that's telling you take a multiple vitamin and take some vitamin C and take some vitamin D, you've got a gem. You've got someone who's really making an effort to keep up. We can't afford to lose these people, okay? Acute care medicine is really, really important. They don't seem to do very well with chronic disease, but we all need an acute care practitioner, and I want mine to be protected because I think she's the best. And so I want to make sure that I get to see her for as long as she's in practice. Let's take care of our medical people when they prove to be interested and on top of the newest research. There isn't anything in nutritional modification that's really going to do any harm. So if the major direction is first do no harm, these are the doctors that we need to protect. These are the doctors we need to tell our friends about. These are the doctors we need to support. If you don't have a doctor like that, fire the one you've got. Find one who is like that. I'll bet your friends know somebody that knows someone who's practicing exactly the way they should be. I do. Call me and ask me someday if you want a good referral. But I'll bet your friend across the street knows someone too. Let's take care of our docs.